Imagine noticing a lump in your breast one day. It's painless, not bothering you much, but it's there. You might think, is this just another lump? For some, it might be something far less common, breast lymphoma. While most people have heard about breast cancer, breast lymphoma is a completely different type of illness. This rare form of non-hodgkin lymphoma doesn't get much attention, but understanding it could make all the difference. Breast lymphoma is not breast cancer. It doesn't start in the breast tissue. Instead, it originates in the lymphatic cells. It's rare, often affecting women in their 60s, and it comes with its own unique challenges. If you, a loved one, or someone you know has been diagnosed, this video will break down what this condition is, how it's different from breast cancer, and what you need to know about symptoms, diagnosis, and treatment. Section 1. What is breast lymphoma? Breast lymphoma is a rare form of non-Hodgkin lymphoma. It's important to understand that non-Hodgkin lymphoma is a type of cancer that affects cells in the immune system, specifically, white blood cells called lymphocytes. Unlike breast cancer, which originates in the breast tissue, breast lymphoma develops from these lymphocytes. In simple terms, this means it's not a breast disease in the same way breast cancer is. Breast lymphoma is typically found in women, most often around the age of 60. Because it's so rare, it makes up less than 1% of all malignant breast tumors and around 2% of lymphomas that occur outside of lymph nodes. Now, let's talk about the two main types of breast lymphoma, primary and secondary. Primary breast lymphoma, PBL, this is when the lymphoma appears first in the breast tissue. It doesn't start elsewhere in the body and then spread to the breast. Secondary breast lymphoma, SBL, this form occurs when non-Hodgkin lymphoma has developed in other parts of the body and spreads to the breast. Section 2, Causes and Risk Factors. With breast lymphoma being so rare, we don't have much information on what causes it. However, a few theories suggest where it might come from. One thought is that PBL may develop from lymphoid tissue near the breast ducts. Other researchers believe that hormones, specifically estrogen, could be involved, as the condition affects women almost exclusively. For those with breast implants, there is another type of lymphoma to be aware of, known as breast implant-associated anaplastic large cell lymphoma, BA-ALCL. This is a unique type of non-Hodgkin lymphoma associated with breast implants. The good news is that BA-ALCL is also extremely rare, with an occurrence rate of about 1 in 500,000 people. Section 3, Symptoms of breast lymphoma. Often, the only symptom of breast lymphoma is a painless lump in the breast. The lump can be large, but since it doesn't usually cause discomfort, it might go unnoticed for a while. Other symptoms are rare, but when they do appear, they might include night sweats, fever, unexplained weight loss. Keep in mind, these symptoms are more common when lymphoma spreads to other parts of the body. With primary breast lymphoma, most people don't experience these additional symptoms. Section 4, Diagnosis. Because breast lymphoma is so rare, many doctors may not immediately recognize it. Often, it's only discovered during a mammogram that's performed for an entirely different reason. If a doctor suspects breast lymphoma, they'll perform a biopsy, where a small sample of tissue from the lump is removed and examined in a lab. For primary breast lymphoma, the test results will show that the cancerous cells haven't spread to other organs. This is a key factor in diagnosing primary versus secondary breast lymphoma. Section 5, Treatment Options. Due to the rarity of breast lymphoma, there's no single treatment path, but chemotherapy is typically the go-to treatment. The primary reason surgery is used is for diagnosis, not necessarily as a treatment. Other treatments could involve radiation therapy, immunotherapy, or a combination of methods. Here's a quick rundown of some of the main side effects of chemotherapy to be aware of. Hair loss, fatigue, infections due to weakened immune system, digestive issues, like constipation, nausea, or diarrhea, changes in weight and appetite, skin and nail changes, nerve damage, which can cause pain or numbness. Section 6, What's the outlook? Here's some good news. The survival rate for people with breast lymphoma is generally favorable. Research shows that people with primary breast lymphoma are about 90% as likely to be alive 5 years after diagnosis as people without the condition. This high survival rate is encouraging and underscores the effectiveness of treatments, especially chemotherapy, for this disease. For those with breast lymphoma in both breasts, the survival rate is slightly lower. Because breast lymphoma is rare, many statistics on survival rates are limited, and they vary based on factors like age, overall health, and how far the cancer has progressed. Section 7. When to see a doctor. If you notice any unusual lumps in your breast, even if they're painless, it's important to get them checked by a doctor. Since breast lymphoma is rare, it might not be immediately recognized. Don't hesitate to push for thorough testing if you feel something isn't right. Conclusion. Breast lymphoma may not be well known, but with awareness, you can make informed decisions if it ever touches your life or the life of someone you care about. Remember, breast lymphoma isn't breast cancer. It's a type of non-hodgkin lymphoma that develops in the breast, and while it's rare, it's essential to catch early. If you're feeling anxious about a breast lump, reach out to a healthcare provider. They can provide the testing you need and help you understand your options. This rare disease reminds us all of the importance of paying attention to our bodies, asking questions, and pushing for answers. Stay proactive, informed, and always prioritize your health. Thank you for watching. Please subscribe for more information on rare diseases and health topics. If you found this video helpful, give it a thumbs up and share it with anyone who might need it. Take care, and stay healthy.